What's up and welcome to the video. My name is Dr. Daniel Ricciardi, gut health expert, licensed pharmacist, fitness enthusiast, and creator of SIBO Shortcut, an online program that provides you with everything you need to eliminate small intestinal bacterial overgrowth. In this video, we're going to take a closer look at a condition that affects over 3 million Americans and about 1% of the population globally. I'm talking about celiac disease. In this video, we're going to talk about what celiac disease is, the signs and symptoms, specifically what happens in your body that causes the symptoms, if genetic predisposition plays a role, how to diagnose celiac disease, treatment, and long-term complications of untreated celiac disease. What is celiac disease? Celiac disease is a chronic autoimmune condition that affects the small intestine when gluten is consumed. Gluten is a protein that's found in wheat, rye, and barley. Due to its sticky consistency, gluten helps food maintain its shape. If you've ever made pizza dough before or handled it, gluten is the reason that pizza dough is able to stretch so far. It can add texture to food, thickness, and prevent food from crumbling or falling apart. Some foods that contain gluten include bread, pasta, cereal, beer, and baked goods. I'm not going to list all of them because we'd be here all day. When a person with celiac disease consumes food or drink with gluten, they will experience unwanted symptoms. Some common gastrointestinal symptoms of celiac disease include, but are not limited to, abdominal pain, bloating, constipation, diarrhea, weight loss, nausea, vomiting, and oily, greasy, light-colored stools. However, celiac disease can also cause non-gastrointestinal side effects as well. Some of these can include, but are not limited to, chronic fatigue, headaches, joint pain, bone pain, mental health problems such as depression and anxiety, and even skin conditions. One in particular with celiac disease is called dermatitis herpetiformis, which shows up as red and very itchy rashes. Okay, so we know gluten is the cause of the symptoms of celiac disease, but why specifically does all of this happen? What is happening in your small intestine that is causing all of these side effects? The truth is, if you have celiac disease, consuming gluten causes your immune system in your small intestine to go into a full-on panic mode. This causes a variety of unwanted effects to happen. Two of these unwanted effects include, number one is leaky gut, also known as enhanced intestinal permeability. This means that the cells of the lining of your small intestine become spaced apart. When this happens, your immune system becomes more active and more inflammation typically results. This can cause a variety of the side effects that you experience. The second thing that happened is destruction of the villi of the small intestinal lining cells. Villi are these small finger-like projections that are on the inside of the lining of the small intestine. Their job is to increase the surface area of your small intestine. This is important because more surface area means when you eat, you have greater area to digest and absorb food and nutrients. However, if you have celiac disease and consume gluten, these villi can actually become damaged and shrink and even become destroyed by your own antibodies. Antibodies are proteins that are made by your immune system in order to protect yourself from invading bacteria, viruses, and other dangerous substances. Therefore, when this happens, it becomes very difficult to digest and absorb food and nutrients properly. Are certain people more genetically predisposed to getting celiac disease? The answer appears to be yes. According to this 2017 review by the World Journal of Gastrointestinal Pathophysiology, they found that the frequency of celiac disease risk HLA genotypes is about 30%, whereas only 1 to 3% develops the disease. This means that it's estimated that about 30% of people actually have this gene called the HLA gene, which stands for human leukocyte antigen, genes that are responsible for causing celiac disease. However, even though 30% of people happen to be carriers of this gene, only about 1 to 3 of the general population actually get celiac disease. So just because you're predisposed and have this gene does not mean that you're doomed to get celiac disease. In fact, it's actually likely that you will not end up with it. For this reason, although there is genetic testing to look for this gene, I don't really think that it's necessary to go out and do this test. In order to diagnose celiac disease, there are some tests that you can do though. Symptoms such as weight loss, diarrhea, chronic fatigue, lactose intolerance, and skin issues all should get taken into consideration when trying to diagnose celiac disease. However, these same symptoms can be caused by a lot of other different medical conditions, so it's not common to officially diagnose celiac disease only through looking at symptoms. And one of those other conditions that can cause gas, bloating, constipation, diarrhea, and other side effects is small intestinal bacterial overgrowth, aka SIBO. My program, SIBO Shortcut Plus, launched on September 1st, 2023, and clients have already been seeing good results in the first few weeks. All the spots for September are currently sold out, but spots for October will be available starting on October 1st. Space is going to be limited. It's sold out by the 10th of this past month and is likely to sell out quickly again. So if you've been diagnosed with SIBO or suspect that you may have it, click the first link down in the description below to get in contact with me and reserve your spot. And back to the video. As I mentioned, the other tests that you can use for diagnosis include, one is blood tests. You would get a blood draw and then they would look for high levels of certain antibodies that are associated with celiac disease. The most common antibody is called tissue transglutaminase IgA, or TTG-IgA for short. As a quick note, if you have been gluten-free for a long period of time and you go in to do this specific antibody test, it's likely that this antibody will not show up on your tests, because if you have not been eating gluten, there's a good chance that this antibody will not have been formed in your body, or at least not been formed in high enough amounts for it to be flagged as potentially celiac disease. The second way to test for a diagnosis of celiac disease is by doing a biopsy of the small intestine. This is a procedure when a small sample of tissue from the small intestine is taken by using a thin tube. The doctor then looks at the cells of the small intestine that were removed under a microscope to see if the villi of your cells is damaged, as I mentioned earlier in this video. If you do have celiac disease, hopefully by using one of these two tools, you're able to diagnose it relatively quickly. As far as treatment options, there are a number of medications that are currently being studied. However, as of right now, the only current treatment is a diet that is 100% free of gluten. You have to be really careful with reading labels and using caution when going out to eat to make sure that no gluten is in any of your food. With consistent adherence to a gluten-free diet, these villi that were destroyed can regenerate over time. The timeline for healing can definitely vary from person to person. Typically, if you go from eating gluten all the time to cutting it out immediately, most people will feel somewhat better right away. However, to make a full recovery, this can take several months or even years. Unless a major medical discovery is made, as of right now, celiac disease is a lifelong condition that needs to be managed with a 100% gluten-free diet. Able to properly treat celiac disease with a gluten-free diet, some potential long-term side effects of untreated celiac disease can include anemia, osteopenia, osteoporosis, and unintentional weight loss. This results from not being able to digest and absorb the vitamins and nutrients from food, and this is due to the destruction of the villi that I mentioned earlier. Developing other autoimmune conditions, unfortunately, is also possible. Some include MS, which is multiple sclerosis, type 1 diabetes, inflammatory bowel disease, IBD, which includes Crohn's disease and ulcerative colitis, and many others. In conclusion, 5 facts for you. 1, celiac disease is a chronic autoimmune condition that affects about 1% of the global population. 2, for people that have celiac disease, consuming gluten can cause a variety of gastrointestinal and non-gastrointestinal symptoms, and this happens due to leaky gut, immune system activation, inflammation, and destruction of villi. 3, some people are predisposed to getting celiac disease. 4, blood antibody tests and small intestinal biopsy are common ways to diagnose celiac disease. And 5, the only current proven method for treating celiac disease is a 100% gluten-free long-term diet. That is all for today. If you enjoyed the video or found it helpful, please give it a like and subscribe to my channel. If this is the first one of my videos that you're seeing, I post a new full-length video every Monday evening and YouTube shorts throughout the week. Thanks so much for watching, and I'll see you in the next video.